Shoulder replacement surgery is something that we perform in an outpatient setting in the vast majority of patients. The patient's medical factors make a determination on whether we can do this at a hospital in an outpatient setting, or as is more commonly performed in an outpatient surgery center itself. Regardless, you'll be in a sling and you'll go home the same day almost every time, unless there's any specific factors that we discuss. There really are two different types of shoulder replacements. One is called an anatomic total shoulder replacement, and that resembles the ball and socket that the patient's actually born with. We shave away the ends of the bone, taking minimal bone overall, and replace them with metal and plastic. This type of total shoulder replacement requires that the patient has an intact rotator cuff to try and keep the ball centered on the socket. In some cases, due to the patient having significant wear and tear of the joint, or if they have a significant rotator cuff injury, we actually try and opt for a different type of total shoulder replacement. This is called a reverse shoulder replacement. And really, this can be thought of as a way to stabilize a joint that doesn't have an intact rotator cuff or that has such significant bone loss that they're not able to be stabilized with our normal implants. This replacement is not better or worse than an anatomic total shoulder replacement. It's just for different patients. We would talk about your specific case in an individualized fashion and make a decision prior to going forward with surgery. In some cases, I actually have backup equipment just in case your rotator cuff actually happens to be torn at the time of surgery. Either way, the surgery takes about an hour. You'll be in the hospital or the outpatient surgery center for the better part of the day, and you'll need someone at home to take care of you just to help for the first day or two. When you leave the surgical area, you'll be in a sling, and once your nerve block wears off, it's okay to take your arm out of the sling and use your hands at waist level. This means avoiding going behind your back or raising your arm out to the front, which both constitute shoulder motion. You can put your sling on and off with the assistance of someone at home, or after you've done it a couple of times, you'll be comfortable getting in and out of it yourself. For most patients, we're able to use a water-resistant dressing, which actually makes your post-op care very simple. Typically, you're able to take a shower right away. It's okay to get your dressing wet, just pat it dry at the end, and we don't want you submerging it underwater. This dressing is very good at keeping water out, but in general, it also keeps fluids in. It's normal to have some blood that comes out onto your dressing after surgery. If it fills up and looks like a water balloon attached to your shoulder, that's something we need to find out about, and we'll probably help you change your dressing. At your first clinic visit, we'll take your dressing down and usually replace the steri strips or the butterfly strips that are across the incision. After that, you can leave your incision open to the air, and you really don't need anything on it, and it's okay to get wet. We do recommend not submerging the incision and not putting any ointments, lotions, or other chemicals to clean or assist in wound healing. The incision will heal well on its own. Soap and water and patting the area dry is fine after a shower. We have more resources on our website, but if you have any other questions, feel free to give our office a call.